Good evening, everyone. Thank you again for joining us tonight. Welcome to our webinar, Functional Medicine Approach to Thyroid Dysfunction, presented by Avexia Practice Management Solutions. My name is Christopher Chu. I am the Director of Marketing for Avexia Diagnostics and will be your moderator for this evening. Let me introduce your instructor for the webinar, Dr. Wayne Sedano, Director of Clinical Support and Education for Avexia Diagnostics. Additionally, Dr. Sedano is the Director of Integrative Medicine Education for the College of Integrative Medicine and lectures and teaches internationally. I will now turn over the webinar to Dr. Sedano.
Well, hi, everyone. Good evening. Thank you so much for joining us on this webinar. Really excited about it. So with no further ado, let's just go ahead and have a look at what we're going to be talking about tonight. So I'm just going to go bullet by bullet. Some of these may seem a little strange to you, but I assure you we'll be able to tie everything in and make this clinically useful by the end of the webinar. So first bullet on the top, I'm going to be talking about the potential contributing factors to thyroid dysfunction. Next, thyroid hormones and a topic called neuroplasticity. You may not be familiar with that, but you will be by the end of tonight's program. Next is to take a look at what's known as a part of the brain called the locus coeruleus and the reaction to this area to stress. And I'm going to show you how it drains an important amino acid called tyrosine. Now, tyrosine is needed to build, it's one of the raw materials for the building of and synthesis of thyroid hormones. So stress actually drains that away. Next, I'm going to be talking about aberrant or poor methylation. Methylation is adding a methyl group to certain parts of the body and certain biomechanics and certainly biochemistry, and how aberrant methylation or bad methylation can affect thyroid function. And I want you to think about it this way. I'm sure you've heard the talk for the last maybe 10 years about methylation. Proper methylation is needed for the body, first and foremost, to repair itself. So it's a pretty important feature, and it does relate to thyroid hormone. Next is that methylation. Again, I want to talk about that in relationship to cancer as well as thyroid cancer. So there's a wonderful illustration on that. Next is gastrointestinal conditions, candidiasis, celiac disease, intestinal dysbiosis. All of that can affect thyroid dysfunction by causing an aberrant presentation of what's known as a TH or a T helper 17 cell that can cause thyroiditis or autoimmune disease, and we'll be exploring that. Next is anemia. Now, you may not be aware of this or not, but anemia can cause chronic inflammation can cause anemia, and there's a specific reason for that. That's why you always want to test before you give iron if somebody's iron deficient, because it can actually exacerbate the problem. And finally, I'm going to be giving you with these slides, and you certainly should be able to have a download of these slides, and Chris will get them to you, a clinical and laboratory checklist that I've created for suspected or known hypothyroidism, so you can work your way through your patients and clients in a reasonable way, in a successful way. So here we go. So let's go ahead and get started. So now, here's the overview of the potential contributing factors leading to thyroid dysfunction. So if you have a thyroid patient right now that you're treating, I want you to think about the patient history. So we'll start with the bullet on the top. Is there gastrointestinal dysfunction going on? Is there candidiasis or dysbiosis like I talked about? Is the patient having difficulty with detoxification? Again, the liver not working properly or gallbladder. Also, the gastrointestinal system does detoxification as well. The autonomic nervous system, if they're stressed out and the autonomic nervous system is upregulated, that will decrease detoxification capability. Next is immune system dysfunction. Now, the gut has a set of cells, set of lymphocytes called T17 cells. When they become dysregulated, which can happen with candidiasis and dysbiosis and even celiac disease, it can cause that particular cell, that Th17 cell, to create an autoimmune, because these cells can also go after organ-specific parts of the body, and particularly the thyroid. Next, are there any methylation defects? And if you're not familiar with that, you will be by the end of this evening's webinar, and how that relates to thyroid disease pardon me, and also other conditions of the body. Environmental toxins, when you're doing your patient history, is your patient exposed to endocrine disrupting chemicals, heavy metals, and the like? You need to know about that. Of course, they may need to do a detoxification. Next, hormonal imbalance, particularly adrenal dysfunction as it relates to thyroid. I think probably by now you've all have probably done a little bit of coursework somewhere along the line. Have the adrenal and the thyroid, they're kind of mates and can play off one another. And adrenal fatigue can seem like hypothyroidism and vice versa, and usually there may be a mix of the two. Next is oxidative stress. The thing that I want to point out is that the creation or the synthesis of thyroid hormones in the thyroid gland needs hydrogen peroxide, which is oxidated in and of itself. So if the gland is not supported with proper amount of glutathione, proper amount of catalase, superoxide dismutase, so forth, and some of the cofactors such as zinc and selenium and so forth, the gland can be exposed to oxidative stress, causing metaplasia or change. You often hear a lot of patients, I know, have come into my office, the doctor said I have a little nodule, it's nothing to worry about. Well, what creates that nodule? Generally an oxidative stress mode that individual is in due to low antioxidants, low glutathione, and so forth. So that can cause damage to the thyroid gland. Next, viral infections, that's certainly been implicated. Patient presents with Epstein-Barr, cyclomegalovirus, herpes simplex virus. All of that has been implicated in subacute thyroiditis and potentially leading to autoimmune thyroiditis. Nutritional factors. Now, I put in celiac disease. It can kind of go into gastrointestinal dysfunction or both. I put it down here mainly because it causes what? Malabsorption. So you're not absorbing iron, which is needed to produce thyroid hormones. Selenium, zinc, iodine, all of those are needed. If there's a malabsorption, certainly individual is going to be hypothyroidism because they're not getting the cofactors needed and the nutrients needed to create thyroid hormones. Next and finally is so important is to assess the individual's mind, body, spirit. Emotional pain can just about cause anything in the body, and I think you're all pretty much aware of that. So that's what's on the plate for tonight. So let's go ahead and get moving. So first thing I want to talk about right out of the gate is something that, well, a subject that you really may not have heard a whole lot about, and that is in regard to thyroid hormones and their effect on what's known as neuroplasticity. So what the heck is neuroplasticity? Well, I'm going to read, pardon me, I have a little bit of a cough tonight, so please bear with me. So I'm going to read the technical definition, and then we'll break that down a little bit. Well, as you can see on the top, neuroplasticity is the ability of the nervous system to respond to intrinsic and extrinsic stimuli by reorganizing structure, function, and connection. So what the heck does all that mean? Basically, what it means is the ability of the brain to form and reorganize synaptic connections, especially in response to learning or experience or following injury. This is extremely important, and thyroid plays a major factor in both developmental and adult neuroplasticity. Thyroid hormones, if they're deficient and so forth, it's going to lead to learning disabilities, potentially emotional disabilities, as you can read on the bottom, because both of those have been linked to thyroid dysfunction. Now, the impairment happens in an area of the brain called the hippocampal area, and that's part of the limbic system where our emotions are, memory, and also spatial navigation. So individuals that come in with hypothyroidism, they have the potential to have emotional problems, memory problems, even problems with spatial navigation. So please be aware of that as well. So the thyroid hormones help out with that neuroplasticity or reorganizing connections. We all have the ability to learn and make new connections in the brain. Now, next, I want to talk about the thyroid hormones itself in a little bit different way. I'm sure you've heard of T3 and T4 and so forth. But what I want to talk about, so you really get a handle on what's going on here, and this is really clinical tonight. I know you know a lot about the physiology and so forth. So let's follow the pathway here. So here's thyroid hormone sitting at here. So one of the raw materials, like I mentioned, is tyrosine, right? The amino acid phenylalanine, right, due to enzymatic reaction, requires iron, B3, which is niacin, and a chemical called BH4, which stands for tetrahydrobiopterin. Now, tetrahydrobiopterin is not classically an essential nutrient because the body can make it in the tissue. However, if the tissue in the body's chemistry is not working properly, it may be somewhat deficient. So this phenylalanine then gets converted to tyrosine. Now, tyrosine is used, as I mentioned, to make thyroid hormones, T3 and T4. But did you know that tyrosine is also needed to make what's known as enkephalins, the body's natural opioids, natural painkiller? Now I want you to think of someone that is extremely stressed out, right? The flow of the pathway may go down this way towards norepinephrine, right? And not have enough thyroid or raw material, tyrosine, for thyroid hormones, and even for the natural opioids. And this is powerful information. So if that's the case, right, the body is going to be showing signs of extreme stress right through here by increasing norepinephrine. So let's follow the pathway down, because if everything is working good, we got phenylalanine going to tyrosine. Tyrosine splits off and is used for thyroid hormones, and the enkephalin's natural opioids. That gets converted to L-DOPA, needing iron, niacin, folate, and also BH4 again. And then L-DOPA, with the help of a cofactor B6, as you know, pyridoxine, creates dopamine, which is the brain's reward and pleasure center. Next, that will get converted to norepinephrine as needed, right? That's in the corpus ceruleum, that part of the brain. That's the fight or flight mechanism. We're all subject to a little bit of stress now and then, but the fight or flight should only be on for a very short time. Once the threat is over, we should go back to a normal, a steady state. Now, norepinephrine gets converted to epinephrine, and then that gets out of the body. What requires norepinephrine to be converted to epinephrine is methylation. There's SAMe, you're probably familiar with that, and magnesium. The point I want to drive home here, if someone is under chronic stress, they are chronically producing norepinephrine, which is slowly metabolized by the body. In other words, it takes a lot of it to get out of the body. Norepinephrine signals an area in the brain that I'll show you on the next slide that is going to wreak havoc in the body if this is not metabolized out. And I'll show you how to do that. What I have over on the side here, and these are in the little yellow text boxes, they're going to represent organic acids of the metabolites of both dopamine and norepinephrine and epinephrine, collectively known as the catecholamines. Now, you can order an organic acid test to see if these particular organic acids, the one right here is homovalinate, and the other one on the bottom is vanilmandylate. If these things are running high in the body, mean that there is a lot of metabolism going on and a lot of stress in that individual. So you can actually check neurotransmitter levels via doing an organic acid test, because low levels of these metabolites in the urine have been associated with low levels in the central nervous system. Some of the signs and symptoms that a patient will perceive are fatigue, depression, and also sleep disturbances. A high amount of these will indicate that the individual is in a lot of stress. I can't overemphasize doing an organic acid test. This is not tonight meant for that, but I want to show you how you can utilize some of these tests and why you would clinically want to do that. Now, back to this little area of the brain I talked about. This is called the corpus ceruleum, so hang in there with me, and it's right here. It's actually in the pons, which is this part of the brain, and the pons is part of the brain stem, as you're probably aware of. There's the midbrain, the pons, and the medulla oblongata, which is right here. Here's essentially what happens, right? This area of the brain is what's known as one of the largest group of noradrenergic, which is norepinephrine neurons in the central nervous system. And when this thing is fired up due to stress level, right, norepinephrine goes up and signals the cortex. It signals the amygdala, which is where we perceive fear and the fight or flight mechanism, anger and survival. Epinephrine also fires up the HP axis, which is the hypothalamus pituitary axis, to release ACTH, adrenal corticotropin hormone, and then go to the adrenal glands. Right, and also norepinephrine fires down the spinal cord to the adrenal medulla, releasing epinephrine, to help out with fight or flight. So the thing here that I need you to be aware of is that under chronic stress, right, the brain will create this whole fight or flight mechanism, and I want you to think about it like, go back on the slide before. It's going to drain tyrosine. The patient's going to present with hypothyroid type of symptoms, and that's really the point that I want to make with this. Now, I want to give thanks to a colleague of mine, Dr. Charles Gant, who did quite extensive work and has allowed for me to share this particular slide with you. Now, what he has determined, that he is a psychiatrist by trade, a wonderful man, and does functional integrative medicine. Now, what he said is excessive synthesis of norepinephrine, right, continued over a long period of time is going to lead to that burnout of the autonomic nervous system. So here's the problem. So how do we decrease that norepinephrine so that the thyroid hormones, dopamine, which is that reward center, and the enkephalins, which is to help out with pain, how do we get them to increase? Okay, because remember, the tyrosine is the precursor to all these substances. So the solution here, as listed here, is that norepinephrine can be drained away with proper methylation. Could use SAMe, that's S-adenosylmethionine, and magnesium, and then slowly and gradually titrate tyrosine along with other amino acids. Some of the testing that you can look at, lab tests, are looking at the plasma amino acids, the organic acids, and a test called the plasma methylation profile, which I really like. That takes a look at the level of methionine, cysteine, SAM, and this is S-adenosyl homocysteine. I'll show you a slide on this, not to worry, it's coming up. Homocysteine levels, cystathione, methylmalonic acid, I'm sorry, serum B12, and also folate B12. And also you can take a look at some of the genetic testing. So that's how you would do that. So let's, I do want to look at this one pathway that I forgot. I kind of snuck this one in here because I think it's important before we look at the methylation pathways as it relates to thyroid. I thought this would be kind of neat because also iron, niacin, and BH4 tetrahydrobiopterin is also needed for the conversion of tryptophan to what? To serotonin. Serotonin needs methylation to make melatonin. Excuse me for a minute. So as you probably know, serotonin is extremely important, and it's in every type of behavior. It affects appetite, emotion, motor, cognitive, digestion, sexual desire, and autonomic function. It has been linked to depression and suicide. This is another reason why I want you to check methylation as well, which I'll show in the next slide. So what I thought might be great, because a lot of patients that are under stress and they are hypothyroidism, adrenal fatigue, I thought I would address this. What are some natural ways to increase serotonin level? I've listed them on the top. Positive emotions. That is extremely important to counsel your patient on positive emotions. Exercise, exposure to bright light. Diet is extremely important. Foods that are high in tryptophan. One particular fruit is milk, by the way. It contains alpha-lactoalbumin and has a significant amount of tryptophan. So I just want to make you aware of that. If the patient is having trouble with methylation, by the way, which is what we'll talk about for thyroid and getting stress levels down as well, they're going to have trouble converting serotonin to melatonin, and they're probably going to end up with difficulty with sleep disturbances. So that's why I put this slide in here. So should individuals with thyroid dysfunction and or nervous system dysfunction have their methylation pathways assessed? And I think you already know the answer to that. It's obviously yes. I've been talking about it for the last several minutes here. And here's why, right? Aberrant or bad gene methylation plays a role in human tumorigenesis. In other words, cancer, including thyroid cancer, right? Many tumor suppressor genes, they are aberrantly methylated, and I'll show you a slide on that in thyroid cancer. In other words, if a gene is methylated, it will turn it off, and I got a really cool slide to get you up to speed on that. Proper methylation is needed for nerve myelination, and also what's known as axonal pruning. I want you to think of pruning a tree. We prune a tree what? So it becomes healthier. You get the old limbs off. Well, our nervous system needs to do that as well, and methylation is required. Now, a decreased level of methylation can result in improper DNA regulation, leading to cancer, and also the expression of viral genes that have inserted themselves in the DNA host, because that's what genes do. So if you have an individual that has recurrent herpes simplex, as an example, or Epstein-Barr, if they are not methylated properly, well, the viral gene will keep expressing itself over and over again. This is one of the solutions as far as stress reduction, is to look at methylation for individuals with recurrent herpes simplex, recurrent Epstein-Barr, and so forth. So that's pretty powerful. Next, methylation is needed to make sure those immune cells are responding properly. So that's why this is important, and that's why I'm stressing this. Now, there is a whole bunch of stuff on this slide here, but I'm going to kind of simplify it the best that I know how. Because as it turns out, this is a little sample of a strip of DNA going across here. It's called the methylome because these are areas of the DNA that are methylated. You're probably familiar with CH3, that's methylation. So, and this is a cancer DNA, what it looks like, right? So this gets a little bit technical, but just hang in there with me just for a few minutes here as we go through this slide. First and foremost, the illustration, as you see up here, looks like a little lollipop right here. That's unmethylated. In other words, not having enough B12 and so forth. This is methylated right here. It's filled in properly. Now the CpG, again, this isn't a course on on DNA and RNA and so forth, but I do need to qualify a little bit of the nuclear bases that are important for this particular slide. Remember, G is cysteine. I'm sorry, C cysteine. Excuse me. G is guanine. You might remember A is adenine and T is thymine. What we're talking about here are the base pairs C and G, cysteine and guanine. Now, when those two come together, that's where a lot of the methylation takes place, because more than half of the genes initiate transcription from the genome with an elevated content of the CpG. CpG. P is phosphate, by the way. So that's what I want you to take home from this particular picture. Now, under normal situations, this is a normal DNA. It's also known as the methylome. They've created a name for it because they're looking at methylation. I want you to think of methylation as turning genes on or turning genes off. That's it. We're going to keep this basically simple. What is important here is that when something is unmethylated, the genes are turned on. As it turns out, this little group right here, you see it here, and you see it here, and you see it here. These are turned on. These are the housekeeping genes, the one that makes sure that the old cells die off, the new cells are properly regulated. If there's damage to the cells, DNA repair and so forth. Notice that these are not methylated and they're turned on. But overall, when we're looking at this strip of DNA, the majority of the DNA is methylated. Things are turned off. When we look at the cancer DNA, you'll notice that those housekeeping genes are now methylated. They are turned off. And overall, as you see on the bottom, there is a global hypomethylation all the way across. Remember, methylation can affect expression of the DNA. That's called epigenetics. And if things are hypomethylated, right, what it will do, it can cause cancer expression in DNA, turn off the housekeeping genes and so forth. That's where doing these tests can be extremely important. And that's really the point of this particular slide. Now, the methylation cycle, you may have seen these particular pictures before. Right? There are two different ways for proper methylation. There's a little shortcut here, and then there is a long cut here. Now, the shortcut to methylation, right, which is right here, right, is right here. That's the shortcut, right? TMG, that's your trimethyl glycine, also known as betaine, and that goes through an enzyme, which is right here, BHMT. That's betaine homocysteine methyltransferase, excuse me. And that will take the homocysteine as it goes through metabolism, all right, back to methionine. Now remember, methionine and then S-adenosyl methionine, that's all needed to create DNA, RNA, proteins, neurotransmitters, membrane phospholipids to keep the integrity of the nervous system, and also for DNA, turning genes on and turning genes off. That is the importance with methylation, if you're not familiar with that. Now, the long way is to go around this way, and that uses, oh, I'm sorry, let me go back. I think I clicked, there we go. That uses B12, you're probably familiar with that. And here are the enzymes, MTR, MTRR. The MTR is methionine synthase, and MTRR is methionine synthase reductase. Don't worry about these, name of these enzymes a whole lot. Just know that this is where 5-methyl tetrahydrofolate is needed, or the 5,10 methylene tetrahydrofolate is needed to create this for methylation, to convert homocysteine back to methionine, back to what methylation is actually needed for. The other part here, just for complete sake, homocysteine, when that can jack up in the body, can create a problem. Homocysteine can go either back through methylation, or it can go through what's known as transsulfuration. That's where we need glutathione, cystothione, and so forth. And this is the enzyme GGT, which I recommend you take on order on all of your laboratory tests. Here are I put some of the substances that can actually help with this methylation: choline, DHA with essential fatty acid. There's 5-methylene tetrahydrofolate here. Methionine, SAMe can help out. The bottom line is that we need proper methylation to create RNA, DNA, proteins, neurotransmitters, membrane phospholipids, and also for proper genetic expression. That's really the whole point here. Now, when you're ordering laboratory tests, I want you to make sure that you're considering homocysteine, looking aside from methylation, but also we're back to thyroid again, because here's the problem. With individuals that are hyperthyroid, that can cause an increase in homocysteine. What it will do is it'll reduce glomerular filtration and it'll impair the liver metabolism, and homocysteine can cause damage to the body, particularly damage to the nervous system and also to the blood vessels. That's why you want to check that out. That's where it's intimately related to a hypothyroid condition. Now, and here's a reference for that article, by the way. Interestingly enough, the brain has a limited capacity for homocysteine metabolism. So that may spark your interest a little bit. And homocysteine can have an excitatory action on the nervous systems. And it's known that elevated homocysteine can be associated with alterations in mental status, cognitive impairment, dementia, depression, Alzheimer's, and also Parkinson's disease. So if you have a patient that has high homocysteine, and signs of hypothyroidism, it can very well lead to these conditions if it's not addressed. So that's kind of the point here. GGT, definitely order GGT as a standard on all of your laboratory tests. GGT is gamma-glutamyl transferase, also known as gamma-glutamyl transpeptidase. Now, what that does is that helps recycle glutathione. Right? Glutathione is pivotal for regulation of our antioxidants, for immune function, for DNA synthesis and repair, and also it's known as apoptosis. That's programmed cell death. If we don't have programmed cell death, we have cells that are turning cancerous because they keep growing and growing and growing. We want them out of the way. GGT is going to give us a good idea of what's going on. If GGT is elevated, could be a sign that the individual is under oxidative stress, aside from gallbladder dysfunction as well. So you definitely want to keep that in mind, because like it says down on the bottom, remember what I told you, thyroid hormone production in the thyroid gland requires oxidative reactions. In particular, hydrogen peroxide, causing increased oxidative stress to the thyroid gland that could lead to nodules. You want to make sure GGT is doing well. There's enough antioxidants in your individual to protect the thyroid gland from those oxidative reactions, and that's really the point there. Next, I want to talk about is the potential contributing factors. Like I said, gastrointestinal dysfunction, candidiasis, dysbiosis is certainly related to thyroid and autoimmune disease. Here's a reference here, and as you can read in the red, there's a growing body of preclinical literature demonstrated that bidirectional signal between the brain and the gut microbiome. You probably should be familiar with that, and it involves multiple neurocrine and endocrine signaling mechanism. Again, we're dealing with the endocrine system, and we're talking about thyroid dysfunction. So we want to make sure the gastrointestinal system is up and running properly. There are no conditions that can cause or relate to thyroid autoimmune disease. Whoop, went by that too fast. So with that in mind, I want to do a quick review of the GI system. Remember, aside from its GI functions, which you're probably all familiar with, the GI system has 3/4 of the body's neurotransmitters. It holds 2/3 of the immune system. It contains 10 times more cells than the rest of the body, and I'm talking about the microbiome. That's all the the good bacteria and hopefully no bad bacteria that's in there. 10 times more than our own body. It also has a genome, when we're talking about the microbiome of what's in the gut, 100 times larger than our own, and there's more metabolic activity in the GI tract than in the liver. Very powerful to make sure from an integrative and functional medicine perspective that the GI system is working well as it relates to all health conditions, and in particular a thyroid dysfunction as well. So one of the testing that I want to talk about, if you're not familiar, the stool analysis, is molecular techniques. I won't belabor these too much tonight, but I want to make sure you're aware of that. You're probably familiar with the microbiological stool analysis. They're looking under the microscope, or they'll grow something in culture, do a culture in sensitivity, but that can only identify a small percent of the bacterial flora and also the pathogens. Now, molecular techniques, if you're not familiar, one in particular is PCR, polymerase chain reaction. It can take a look at the DNA. right? So it's a method to quickly amplify minute quantities of DNA to get a whole bunch of copies. So why do you want to get a whole bunch of copies? Well, you want to be able to identify microbes that are difficult to grow in culture or are slow growing. So what PCR is, this is a very simplified version. They get some nucleic acid extract, they isolate it, purify it, then they concentrate it. And bottom line is here in the red, the goal is to make enough of the target DNA region so it can be analyzed. It can say, yes, you have this particular bacteria, this virus, this parasite, this fungus is in, because it was a match with the what's known as a probe, the DNA strand matched, and you get wonderful tests back. So that's part of a lot of advanced stool analysis tests, and I want to make you aware of that. Most testing now are using PCR testing, are using what's known as multiplex testing. In other words, they can test use a whole bunch of probes in one sample and get a really wonderful test results back to really find out what's going on. Remember, a lot of bacteria have been associated with potential autoimmune triggers as well, and particular thyroid triggers as well. That's really the point here. Now, with regard to certain bacteria, and in this case, a fungus that can cause a problem, candidiasis. Candidiasis is known to perpetuate autoimmune thyroiditis. Yeast, as you're probably aware, can suppress the immune system. It's toxic, and a lot of the symptoms can be similar and cross over to hypothyroidism, the fatigue, the lethargy, the foggy thinking, constipation, irregular menses, bloating, belching, intestinal gas, decreased libido, stool in the mucus, and cold extremities. By the way, if the patient complains of a lot of stool in the mucus, it may very well be that they have food sensitivities, and you might want to test for that. Now, there's also the connection. Oh, let me just do this slide first before I talk about the immune cells in the gut. Just a little clinical pearl for you that patients suffering from symptoms attributed to chronic candidiasis, they frequently have elevated thyroid antibodies, particularly thyroid peroxidase antibodies. So if there's a history of candidiasis, and that can contribute to thyroiditis in the gut, it can irritate these Th17 cells, which are organ specific, and irritate the thyroid gland. There's definitely a connection there. So if there's a patient with a history of recurrent vaginal yeast infection, or a history of a lot of treatment, antibiotics or contraceptives or systemic glucocorticoids, check them out for yeast. A stool analysis may be in order, which I like better than looking for antibodies, by the way. Now, in the gut, there are some lymphocytes called Th17 cells, right? Helper cells. They are associated with organ-specific autoimmune disease, and like it says here, including autoimmune thyroiditis. Right? The Th17 cells, they can be activated by GI dysbiosis, particularly pathogens and opportunistic bacteria, as well as yeast overgrowth, and as you see over here, gluten as well. Here's what happens. This cell can become activated by these conditions: Candida, Klebsiella, Bacteroides fragilis, Borrelia burgdorferi, you may know that as Lyme disease, Mycobacterium tuberculosis, Yersinia enterocritica, which has been associated with Graves' disease. All of that can be picked up with PCR testing, by the way, I think a little bit better than standard testing, and can activate these cells, which can activate this due to more than likely what's known as molecular mimicry. So I definitely want to keep that in mind. That's why if the GI system needs to be checked out on all thyroid patients, and in my opinion, I won't treat a patient without taking a look at doing a comprehensive stool analysis. There's just too much information. I can get over that. Now, to help out the patient. One thing I do want to mention, you may have heard of biofilm. Biofilm can sequester the bacteria and hide it. So sometimes not everything may show up on standard tests and even PCR testing. So my point is that you may need to use some natural agents to break down the biofilm and then retest. Here are some natural agents I have listed for you. Ceratopeptidase, garlic, alpha amylase, chlorogenic acid. That's found in coffee, by the way, Boswellia, and also silver, just to be complete if things don't show up. So some of the diagnostic tests to consider for addressing potential inducers of Th17 autoimmune disease, particularly thyroid disease, do that stool analysis. Maybe a breath test looking for SIBO, celiac panel that I mentioned, because that can irritate that Th17 cell, causing the body to go after the thyroid gland, intestinal permeability, and of course yeast overgrowth, like I mentioned several times. Now, Onto a little different topic here. And I wasn't sure whether or not to put this in there, and I decided, you know what, I think it's kind of real important that all docs have an understanding of this. There is suppression or anemia that is created due to inflammation. So the question becomes, chronic inflammation, by the way, why would the body do that? What is going on here? Why would the body do that? So feel free to follow the bouncing ball here. So, excuse me, there's inflammation in the body. The body's going to have these little chemical messengers here. This is tumor necrosis alpha. This is interleukin 1, interferon alpha. It creates these messengers. It creates interleukin 6, by the way, all these messengers to relay messages back and forth to the body. Here's the point with chronic inflammation. Usually there's some kind of infection going on. The body is reacting, and it wants to keep iron down. Now, why does it want to do that? For two reasons. Because iron is very oxidative, causing an increase in oxidative stress. Number two, bacteria and parasites, they love this thing. They feed on iron. So the body is trying to lower that. All right, to say, okay, until the infections, is gone, and the inflammation is down. And sometimes that doesn't happen if the individuals, if we're not treating that or addressing that. So here's what happens. Right, here's some inflammation. The body sends this little, it's called a cytokine called interleukin 6, which makes a thing called C-reactive protein that you may be familiar with. The liver will make that. Right? So C-reactive interleukin 6 goes to the liver, and the liver makes C-reactive protein, but it also makes this other chemical called hepcidin. Right? Hepcidin is a natural antimicrobial property, but it also decreases iron supply. It's trying to cut off the food supply. Is what that's doing. So what you'll see with chronic inflammation is low serum iron, low transferrin. On the other end of the spectrum, the other inflammatory cytokines will cause the kidneys to reduce the production of what's known as erythropoietin. Now, erythropoietin will go to the bloodstream until the bone marrow, okay, we don't need any more. Don't make any more cells. And that's what's going to happen, all due to inflammation. And that's where you get the anemia of chronic inflammation. My point of stressing this home is, please be cautious of starting to feed your patients or give your patients iron if it's low, because you may be adding to the inflammation, adding to oxidative stress, and also adding to the bacteria. If they're very low, they're going to need iron. But I just want to make you aware of that. I thought it'd be a good idea to just as a little refresher, because a lot of these folks with adrenal fatigue, hypothyroidism, they show signs of anemia, and this may very well be the reason for that. I'll have a little slide for you. Hopefully you get a copy of these slides. These are some conditions associated with reduced erythropoietin, inflammatory states like I talked about. So what's the cure? Get rid of the chronic and acute bacterial infections. Treat the collagen vascular disorders. Work on the malignancies. That is possible with natural medicine, and also there's plenty of good docs out there that are doing wonderful work with cancer, by the way, and we can work as a team for truly integrative medicine. Renal disease, hypometabolic states, certainly endocrine disorders as well. It's all going to create this low or reduced erythropoietin leading to anemia, but now you know what may be causing that and the reason for that. So back to thyroid here a little bit. So it's a slide for you. This autoimmune disease of the thyroid. So here in the center, always want to look at methylation defects. Make sure that the thyroid is up and running properly, because methylation defects can affect the thyroid gland and other parts of the body. I think I stressed that enough. So over on the right is Hashimoto's thyroiditis. On the left is Graves' disease. So let's go to the right first. So Hashimoto, what can cause that? Infections. Dysbiosis. There could be a genetic predisposition. Celiac disease is related to that. Immune system dysregulation, those T17 cells I talked about, that will cause thyroid autoantibodies, TPO antibody in particular, which is thyroid peroxidase antibody. And on this side, we're looking at destructive nature. Right, the thyroid gland becomes destroyed. There's immune cells in the gland, and eventually the thyrocytes die out. On the other end of the spectrum, Graves' disease, conditions that will set that up in motion. Stress, toxins, genetic factors, problems with the vitamin D binding protein, immune system dysregulation. Now, certain bacteria, particularly Yersinia and Enterocolitica, can irritate those Th17 cells and are connected to this Graves' disease as well. These are the particular antibodies you'll be looking for Graves' disease. Certainly, thyroglobulin antibody, TSH. I'm sorry, TSI, that's thyroid stimulating immunoglobulin, will be up. This is one of stimulating. What happens is that the gland starts overproducing, or the receptors go to the thyroid gland and it starts making more thyroid hormone, which is why you get hyperthyroidism. So that should help you out quite a bit. Now, the last part here is I put together, because we really see more hypothyroidism, and I put together a little checklist for you on the next couple of slides. Check out the adrenal stress, emotional stress. Here are some tests for you to consider. You do not have to do all of these, but I certainly recommend you use it as a checklist. You can write your test results, working diagnosis, and commentary here. With regard to a thyroid panel, you certainly want to order all of these. TSH, free T3, free T4, TPO antibody, thyroglobulin antibody as well. You want to use it for diagnostic, for baseline, for monitoring, and in general, retesting or for monitoring every 4 to 6 weeks until it's stable. Now, this individual, you may need to go an entire year and a year and a half, but you will see results addressing the potential areas that I had talked about in this webinar. Some of the basic testing, you definitely want to do a CBC. Check out for anemia, check out for infection, check out for allergy. Look at C-reactive protein. Right? You want to check inflammation. Homocysteine, I already talked about that. If uric acid is up, by the way, that's another sign of oxidative stress. GGT I talked about, because that means an increased demand for glutathione. Remember, oxidative stress, you want to get your patient out of oxidative stress. Also, sugar regulation, do the hemoglobin A1C. The nutrients that you want to check on your individual: vitamin A, vitamin D, zinc, selenium, iron panel. RBC fatty acid test, I think, is very important. Urinary iodine, and certainly an amino acid profile. You can do a lot of these, and what's Avexia offers a NutriVal test that really can cover the bases on a majority of these. So you might want to consider that as well. A basal body temperature, if you're not familiar with it, get familiar with it. You can use that. It's a wonderful tool, using a metabolic temperature graph, getting a baseline on your patient, and you can use this over here for a checklist. Here, diet history, certainly. You want to check for any food allergy sensitivities. Check for celiac disease, gluten sensitivity. Again, just to recap, celiac disease and even gluten sensitivity may irritate those cells in the gut that are the Th17 cells that are known for organ specific damage, including autoimmune thyroiditis. Physical activity level, GI testing, I suggest using PCR testing. Check for SIBO, dysbiosis, malabsorption, digestive enzyme deficiency. All that can be checked with a lot of these newer tests out right now. They're wonderful. Medications, have your patient list the medications that they're on and go look them up and see if they interfere with thyroid function metabolism. Odds are they probably do. Get an environmental history on your patients, see what they're exposed to. If you can get an idea what they're exposed to, you can certainly look that up and see if it affects thyroid function. They have the word glyphosate on there. This has been getting, if you're familiar with that, that's Roundup. That has been getting a lot in the news lately. It has been associated with causing potentially leaky gut or irritating the gut lining all by itself. And it may not necessarily be that individuals are reactive to wheat or gluten. It may be the cause, or it may be both. So something you might want to consider. Oxidative stress, if your individual's under a lot of oxidative stress, an organic acid test is certainly helpful. And then check for co-infections, particularly Lyme or other infections, as history would dictate. So we're getting near the end here. Here, Avexia offers just some wonderful blood panels. There's the Avexia thyroid panel, and then the Avexia comprehensive thyroid panel. After your patient history, go ahead and do pick the test that you think you need most, based on, just so we all have a baseline. The baseline thyroid test that you need to look at, just to start with an assessment, is THS, free T3, pardon me, and free T4. Those are the bare minimal, and these tests certainly go above and beyond that. And there's a lot of autoimmune disease out there, as you probably know, thyroid, so these are a great value. Next, if there are other complications going on with your patient, Avexia also has the Avexia female elite panel. What you're going to get in there is the CRP is going to be in there, CBC. It's going to take a look at DHA, cortisol levels, and so forth, vitamin D, progesterone. So that's a really, really good comprehensive panel. Chris, or you can call Avexia and get the details on that. And the other is the male, from the male patient as well. Similar analytes. Testosterone, I believe, is in here as well. So, okay. So just to refresh your memory here, what some of the tests that I talked about, comprehensive, or that should be an organic acid comprehensive profile right there. That's an organic test, essential. I'm sorry, pardon me, organic acid test. They also offer a GI map. That's just the brand name for one that does the PCR testing, so that is available. The NutriVal test, it could be first morning void or in plasma. That's going to take a look at the antioxidants, the vitamin nutriture of your patient, as well as the amino acid profile. It's a really good test. If you need to take a look at these advanced testing, most of these patients, individuals are depleted, and these tests can really help out. My gold standard is sitting right here. I need to take a look at that GI, as you know. My next one is here. So if I of those tests, but again, a NutriVal extremely helpful. Other tests, you need to take a look at that methylation. You're not sure of what's going on. This methylation, by the way, it's not looking at SNPs. It's looking at the actual analytes and see if there's enough of them there. Is there enough SAMe? Is there enough methionine? Is there enough cystathione, that individual? That's what that particular test is going to tell you, and it will let you know, what do I need to add to that patient to make sure that those pathways that I showed you, the long and short pathways, are functioning properly. Next, adrenal function panel. That's going to be the 4 samples looking at the adrenal index. Very important. The patient is stressed out. If they're burned out, you need to know what's going on and do adrenal restoration on the individual, because it relates certainly to thyroid hormone. The individual is stressed out. Thyroid hormones will tend not to work properly or get converted to reverse T3, which is not going to be as active as regular T3, and cause the patient's metabolism to go down. If there's a suspicion for celiac disease, you can order Avexia celiac disease screen, or you can order the celiac gluten sensitivity panel with serum or blood spot. Either way, it's pretty good. Remember what happens with gluten and gluten sensitivity. It irritates those T17 cells, which are related to autoimmune thyroiditis via organ-specific immune dysfunction. That's what that's about. Also, Chris is going to mention here, I don't know if anybody's familiar that Avexia is just a wonderful product line. It started last year, or it could have been earlier this year. Please, yeah, it was last year. Gosh, we're in 2019. Forgive me.
You just move into each other, Doctor.
Yeah. Oh my gosh. Yeah. So please take a look at that. There's Thyroid Plus that applies to the raw materials, adrenal restoration, adrenal complete, adrenal plus. They do have that nutraceutical line to help you out as well. I'm going to go ahead and turn this part over to Chris. I just want to mention, but before I turn this over to Chris to help you out a little bit, is first and foremost, you basically have, if you look back, and please get a copy of these notes, you basically have a format to follow to help with your checklist. Please take a look at that. Please take a look at these slides. And also, if you have any questions, email us. So I'll turn it over to you, Chris, and I'm going to hang in there.
Yeah, we just want to promote that. We talked about the panels, the doctors, obviously done a great job of covering the thyroid aspect of this. But one of the services, a really exciting and powerful tool we have now through our Avexia links, which you use for ordering your tests and panels, et cetera, is patient pay. And we really think it's something that, all clinicians should be using. It can save you time and free up your cash flow. It basically allows you to order panels, tests, and now nutraceuticals, and soon to be specialty test kits for your patients, and have them pay for them if you so choose. In the flow of ordering, it's easy. It's a one-click modal that comes up and asks you whether you want to pay for that, which is customarily how it's done, or you can now have the patient pay directly. They will come in on their own module and be able to see what you've ordered for them, and pay right there. It really is a great way to promote these services. You can also set your retail pricing, so you can go with the normal MSRP, or you can put different percentages. It just eliminates a lot of back and forth and saves you time, to spend with your patients, which is the most important thing. We're all about supporting your practices, but also, alleviating those pain points. So one of the things is to sign up for it. You call our client success team, and we'll get you hooked up. You just have to sign our agreement and set your retail pricing, and you're off and running. And again, it's a great service because it's an option in your Avexia Link ordering process that you can choose or not choose to use at any time. So we're really, happy to have this service, and we really think everyone should be on it. It will help all clinicians with their practice. So, obviously, if you liked any of what you saw tonight, we want, you have questions, we want you to contact us at 888-852-2723. Dr. Sedano also has Ask the Doctor feature on our platform. So, but as always, you can just use email to any questions, info@avexiadiagnostics.com. Those are our office hours for calling in there from Monday to Friday. They're extended business hours, 8 a.m. to 8 p.m. And, we look forward to hearing from you. If you would like slides of this webinar, we will be happy to provide them for you, as well as a link to the recorded session. So we invite you to review this materials over and over again. And just want to thank Dr. Sedano for doing such an excellent job tonight.
Thank you so much, Chris, and thank you all for listening. I know this is not easy to work your way through the integrative and functional medicine approach, but with patients, you're going to do very, very well, and hopefully we've laid something out that is clinically useful for you. So I want to thank you again for your time, and it's my honor. Thank you, Chris.
Well, we hope everyone has a safe and enjoyable evening, and thank you for attending.
Okay, good night.
Thank you, Doctor.